Hello and welcome to the long-term follow-up discharge orientation class. I'm Rose Rivette. I'm one of the long-term follow-up nurses, and I'm going to be talking to you for the next hour or so about what to expect in the next year and beyond post-transplant. So first of all, congratulations on getting to this point and being part of this class and listening to this video. I always think this is a really great milestone when your team schedules you for this class as they are ready to see the back of you for all the best reasons. So what are we going to talk about today? This is going to be an introduction into the long-term follow-up department. And then we're going to talk about what to expect in the next year and beyond after transplant. What are your risks and concerns to be thinking about? How can you keep yourself healthy? And how are we partnering with your home physicians and team to keep you healthy? And finally, the last section is going to be specifically on chronic GVHD, or graft versus host disease. And this is a specific complication for our allogeneic patients who had donor cells for their transplant. So who is long-term follow-up? What do we do? Well, we're a unique department here at the SCCA. Our mission is to provide lifelong medical consultation to all of our post-transplant patients throughout the rest of their lives, both to patients, to their providers, to anybody on your team caring for you if you're treated with your transplant here at the Hutch and SCCA. Our department has three parts, three sections. We see patients on the clinical side over in the SCCA clinic on the 6th floor to do a GVHD assessment and for your annual evaluations if you do come back here for those CVAL appointments, as we call them. We have a research side, and those are the folks who will send you an annual questionnaire, the Patient Recovery Questionnaire or the PRQ. It helps us to stay in contact with you and your providers so that we have a means to distribute information back to you, and then you can contact us as well. And then our telemedicine side, and that's where I'm a part of. We are the telemedicine telephone consult service for all patients and providers. And so a little bit about how that works in a little bit in another slide. So I'd mentioned the annual evaluation, the CVAL appointment, and if you had an auto transplant or your own cells, that type of evaluation can typically be done with your home provider or your local physician. So we're happy to direct them as to what tests and procedures should be done around the 1-year post-transplant mark. And if they need any assistance evaluating those results, we're happy to provide recommendations from our attendings as well. If you had an allo transplant or somebody else's cells, donor cells for your transplant, then we typically recommend to return to the SCCA, to LTFU, for that evaluation, because in that situation it involves a component of a GVHD assessment, which is best done by our GVHD experts here at the SCCA. It is quite an involved appointment. The CVAL typically takes place over about a week, so you'll show up on a Monday or Tuesday, have a full assessment, labs, testing will be repeated that was initially done when you first arrived, and towards the end of the week you'll meet with the team again. They will review those results and discuss future recommendations for your care. So because this is so involved, it takes kind of a big chunk out of your life to come back to Seattle and go through this appointment. We typically recommend to call us, put it in your calendar, your phone, give our office a call about 6 months prior to your 1-year anniversary and get that booked on the schedule so you can make your plans as well. On the other side, if you are unable to return to Seattle, or this is something you want to do with your home physician at home, then by all means give us a call. Let us know you'd like to do what we call hometown workup, and we're happy to send our recommendations to your provider so that they can get those tests and procedures set up as well. So what do we do on the telemedicine side? Well, once you leave your active team here at the SCCA, the LTFU office is going to be your first point of contact should you or your providers have any post-transplant questions or concerns, anything going forward. We are purely a telephone consult service, so we don't write orders or see patients in our office. So if you have an urgent or emergent concern, please see your local provider or go to urgent care or the emergency room. So how this works is by phone, email, fax, whatever works for you or your provider. You'll contact our office, and within 24 to 48 business hours, one of our long-term follow-up nurses, such as myself, will return your call. About half of the time, we are able to answer your questions simply based on your history, looking in your chart, or using our protocols and policies. But about the other half of the time, we need to involve our attending physician for further recommendations. So we meet with our attending physician 3 times a week. We'll present the cases, we'll get their thoughts and recommendations, and then pass that back to you or your provider, whoever initially called. So that's the process. It takes, it's not an immediate return on calls because we often need to gather further records, talk with your provider's office, and look up more data to give you the best answer for your questions. So going forward, how can you help yourself to stay healthy? How are we helping you to stay healthy? Infection prevention is going to be the first and foremost on your mind, as it probably has been through your whole transplant course. A lot of the recommendations that you've been following and doing to keep yourself healthy for the past several months will continue to apply for at least the next 12 months. Throughout this discussion, I keep mentioning the first year or the first 12 months post-transplant. And what I'm referring to is that 12-month period from the day that you got your cells to your 1-year anniversary of that date, regardless of when you actually left the SCCA and your active team. So what we want you to do is to continue avoiding people who are ill, have any symptoms of a contagious type illness, or who've had symptoms in the past 24 hours. Continue washing your hands, using the same hand hygiene guidelines, using alcohol gel where appropriate, and encouraging any of your family members and caregivers and household members to do the same. Continue to avoid crowds, but not to the same extent. So we don't want you to isolate yourself to stay in a bubble. We do want you to start getting back out and enjoying things that you used to do. Just using some strategy and thinking through of how much control will you have in that environment and among who's going to come into contact with you. So a few things that change once you leave your active team. It's regarding pets and houseplants. It is considered safe to have your furry pets come back and live with you, whether you're moving back in with them or they're moving back in with you in your home. Your dogs and cats who were known to you before transplant are safe to be in your home. Now you're still exempt from cleanup duty, so you can designate someone else in your household to clean the litter box or pick up after the dog on the dog walks until at least 12 months post-transplant. The other exception is we don't recommend having the animals sleep in the bed with you, not necessarily because of proximity, but because you aren't as aware of where they are in relation to your body, your face, or your central line, if that's still in place. And we don't recommend sharing your household with other pets such as birds, lizards, or reptiles, as it's just not feasible to fully sanitize against organisms that might be present in their stool. Another situation that comes up after discharge is travel by air or by train. And obviously this is not a situation where you can avoid crowds or really have a lot of control over who's going to come into contact with you. So some recommendations we have are to either call ahead, or when you get to the flight, ask to board early for medical reasons. You don't have to give them your whole health history, but explain that you are immunocompromised. When you get on board, have your traveling companion wipe down all the surfaces around your seat, your tray table, the seat back, the armrest, the belt buckle, all these the hard surfaces that other people have likely touched or coughed on. Bring your own food and drink on board so you're not having to accept any drinks or take water from those open pitchers that go up and down the aisles. And if you're seated near anybody who appears ill or has symptoms or is coughing, again, ask to be moved for medical reasons. This is a situation where wearing a mask often comes up, and you've probably heard from your team or you've heard from your nurses that wearing one of those respiratory masks is not actually effective after about the first 15 or 20 minutes. Once it becomes moistened with your breath, it's not effective to prevent transmission of organisms. However, in this situation, if you're wearing a mask in the airport, other people might think something's wrong with you, and they're going to give you extra space. And that's exactly what you want in this situation, is to give yourself that nice kind of at least 6-foot bubble of people giving you some extra room. And if you're wearing a mask, it's also just a constant reminder to yourself not to touch your face, to keep your hands clean, to be using your hand gel in that type of situation. So we've kind of talked about it a little bit so far, thinking about how to keep yourself safe and healthy and prevent infection. And there aren't any very clear black and white guidelines. It's often a gray area, depending on a lot of different factors with you and the situation. So some ways that you can think through it are considering how far out am I from transplant. Obviously, your risk is much lower 11 months from now versus today. What level of medications are you on that suppress your immune system? If you're still on a high therapeutic dose of tacrolimus, you have a higher infection risk than if you're tapering off or on a very low level. And then considering in this environment or activity, how much risk is there and how much control do you have over it, and keeping your space or around who's going to come into contact with you. So we're happy to discuss these things with you. We get a lot of calls in long-term follow-up where somebody wants to know, I'm this far out post-transplant, is it safe for me to do X, Y, Z? And one of our nurses will be happy to talk you through how far out you are, what your labs are, what medications you're on, and give you the best assessment of what that risk would be to you so you can make the best decision for going forward. So we have in one of the packets of information, it's called our Preparing for Departure packet. You can find it online or request it from your team nurse or from our office. We have a table of the most commonly asked questions that patients were sending in either by email or by phone. And what we did was we presented all those situations to our infectious disease doctors and asked, when are these types of things going to be safe for our patients and at what point after transplant? So you can find that table there. Currently it's on page 19 in the Preparing for Departure packet, although things change. Some examples of these types of questions are, can I go swimming? Yes, after 6 months post-transplant, and if you're off immunosuppression and your central line's been removed, it is considered safe, and it's encouraged as actually a really good form of exercise, low impact, and to help you regain your strength and reduce fatigue. Can I work in my garden? This is something that comes up, and I think people are either really bummed or really relieved to hear that we don't recommend any yard work or gardening for the first year after transplant and until you're off all immunosuppression. What we're really concerned about are fungal spores that live in the soil or dead materials and can cause a type of fungal pneumonia, which is very difficult to treat in our post-transplant patients. So this includes everything from mowing the lawn, raking leaves, working in your garden, harvesting veggies, those kind of things. You'll have to delegate to somebody else until it's safe for you to do that. Something that always surprises me on that list is, can I go camping? And actually, yes, this is considered safe enough from the time that you leave your active team. And this is a good example of something to be thinking strategically. Obviously, it's going to be safer if you're camping in a yurt on a raised surface, not on the forest floor in the wide open air. And also having awareness of, do I have cell phone coverage? What's my exit plan? How can I get help if I need to? Obviously bring your own food in as opposed to foraging for wild mushrooms. But in essence, there's nothing infectious or dangerous about camping as long as you're using common sense at this point. So as well as these things and activities that you are monitoring and doing to help keep yourself safe and infection-free, we recommend remaining on certain medications, prophylactic or preventative antibiotics for a time frame after transplant to help prevent other illnesses. One of them is Bactrim. We recommend continuing that until at least 6 months post-transplant to prevent a type of PJP and encapsulated pneumonia. The other medication is an antiviral called acyclovir. You may be on valacyclovir or Valtrex instead. We recommend this for the full first year post-transplant to prevent a reactivation of shingles or the chickenpox virus, which is, as you know, is an opportunistic virus. It stays dormant in your nerve cells despite everything that we've just done to your body, whether it was with chemo or TBI or anything else. We cannot wipe out that virus. So if you're under stress or your body's immunocompromised, it may reactivate, causing shingles, which can be very painful and have long-term complications. These two medications, while they seem quite simple, have actually really changed the transplant course for our transplant patients. In the early years before we had these preventative medications, there was a very high incidence of infection, morbidity, and mortality from these diseases. So they are very important to continue until your body has full immune reconstitution of your own. Another way that we are helping to build your immune system and prevent infection is by vaccines. So we will restart your entire vaccine series once you reach 1 year post-transplant. So as if you and your new immune system is a brand new baby, we're going to start all over as day one from when you were born, probably with even more vaccines since there are more out there now than when most of us were born. At that 1 year appointment, whether it's here at the LTFU at the SCCA for your CVAL or whether it's with your home physician, you will start by getting 7 non-live vaccines at that time. And then over the course of the year, every 2 to 4 months, there'll be booster shots. And we will make sure that your physician has a copy and you have a copy of this vaccine schema to keep up with those important dates. Once you are 2 years post-transplant and off all immunosuppression, you'll then be eligible for any live vaccines, and that includes the MMR, the measles, mumps, and rubella. Another exception to our vaccine schedule is the flu shot. We recommend that all post-transplant patients get this as soon as they are 6 months post-transplant. So depending on the schedule, if that hits in the summertime and this year's shot is no longer available, just go ahead and get the next year flu vaccine when it's available in the communities around September or October. And your family members, household contacts, and caregivers should all have had the flu vaccine, or if not, get that as soon as possible, and as that's the best protection for you until you're able to be fully vaccinated. So returning to work and school is often the next step or the next hurdle for most of our patients. In an ideal world, we would recommend that our post-transplant patients stay out of work or school environments for at least 1 year post-transplant. We use that 1 year guideline because we know from our research that the average post-transplant patient has nearly full immune reconstitution by that point, as well as they are just about to start their post-transplant vaccine series, providing them the most protection. But we realize that it's not an ideal world and some patients need to return to work sooner. Some patients want to return to work before 1 year, and in some situations it is safe, and we're happy to discuss with you the particulars of your situation to help determine the best way forward. For example, if you work from home, there isn't an increased infection risk in that environment, but you will be dealing with increased fatigue or decreased energy levels with returning to a schedule. Other situations, if you work at the front desk of a pediatrician's office, that is not going to be safe for at least a year. And we recommend all children, students, and school teachers to stay out of the school environment until they are at least 1 year post-transplant as well. But we do know from our research as well that over 75% of all of our post-transplant patients do return to work in some capacity or other, not necessarily the same position or the same schedule, but in some way for their new normal. So other things that our patients are facing in the first year, this runs a huge gamut of things because it's important to recognize that you can't have the diagnosis and have gone through the transplant that you've just gone through without having nearly every system of your body's affected in some way. Not all the effects are going to be visible within the first few months while you're here with us, but may show up later over the next year or next couple of years. So it's important to keep in mind from a post-transplant perspective what you're looking at. The main things that we see in the first year are both emotional and a physical impact. And with nearly all of these cases, we recommend to be aware that it does take up to a year post-transplant to really get back to your baseline. For example, for fatigue levels, even though in your head you get home and you look good, you feel good, you're ready to get out and do what you used to do, and your body's just not ready or caught up to be there. Your recovery time will probably be much longer than it used to be, and just giving yourself that permission and that recovery up until a year post-transplant to get back to where you were. We know that our post-transplant patients have cognitive and memory issues and concerns, everything from short-term memory loss, trouble focusing, trouble with cognitive problem-solving skills. And this is also quite normal, and we do expect it to mostly resolve by 1 year post-transplant. However, you're still struggling in any areas at this point, definitely let us know or speak with your local physician. We can do some neurocognitive testing to identify areas that you're particularly struggling in and provide support. We also hear a lot about emotional ups and downs in the first year post-transplant particularly. We know that our post-transplant patients have a higher incidence of depression in the first year as compared to the general population. And so just being aware of that for both yourself and your family members and caregivers so that you can look for signs or symptoms and seek help and resources when you need to. As a post-transplant patient, it's important for you and your providers to be aware that you have a higher risk factor for cardiac issues as well as metabolic syndrome, and that includes things such as high cholesterol, high blood pressure, high blood sugars. So it's important to monitor for that and be aware with your history, knowing what they're looking for. Other issues that continue through the first year and start to resolve are oral issues. This is dry mouth, taste changes, things that you've likely been going through throughout transplant. We do encourage you to see your dentist at 6 months post-transplant simply for a full exam so they can get a good idea of where the baseline of your mouth is post-transplant after everything you've been through. But we do recommend avoiding any elective procedures for at least a year post-transplant until you're off immunosuppression. Sometimes things can't be avoided. Sometimes you need an emergency procedure, and we're happy, if you want to contact our office, we're happy to put you and your provider in touch with our oral medicine folks, and they can give the best recommendations as how to go ahead with the procedure that's needed and reduce the risk of infection. Other issues that continue are eye issues, and this is dry eye. There may be visual changes, especially if you've been on prednisone or other certain medications. And be aware that you do have a higher risk of cataracts than the general population, so part of our annual screening and guidelines includes seeing your ophthalmologist or optometrist for that assessment. We also recommend trying to avoid getting a new prescription for your glasses or contact lenses in the first year post-transplant, as some people have visual changes either from the transplant process or medications that you were on that continue to resolve through the first year. So we'd hate for you to get a new set of glasses because things are different right after transplant and then need yet another prescription in a few more months, because oftentimes the insurance companies don't see it the same way when providing those. Another risk factor that you have as a post-transplant patient is a higher risk for certain subsequent cancers. And again, this is where annual screening is really important. You'll find our list of annual screening guidelines on our website. You'll get a copy of it with your documentation, and that is provided to you when you leave your active team, and or you're welcome to call us, and the nurses are happy to go over these guidelines with you. The most frequent sites that we see these subsequent cancers are skin, oral, breast, and thyroid. And so those screenings are included to have an annual skin check with your dermatologist, to see your dentist twice yearly. We recommend mammograms for our female patients who are 35 and over, or 8 years post-transplant, whichever comes first. And thyroid screening is an annual blood test. Also be aware that this cancer risk increases the further you're out from transplant. So the numbers start to rise once you reach 10, 15, 20 years post-transplant. Your risk compared to the general population will be higher. So in addition to, even though I've mentioned all of these risk factors and new concerns that you have about your health after transplant, it's important to know that there's still a lot of control that you have to mitigate these risks and to keep yourself healthy. And things that you can do include avoiding sun exposure. That's at the top of the list. That helps prevent both subsequent skin cancers and a GVHD flares that we see. Exercise is very important in so many factors for increasing cognitive functioning, decreasing fatigue, energy levels, bone health, a lot of other things. Healthy diet is important. This can help reduce your cholesterol levels, blood sugars, and blood pressures, and your cardiac risk factors as well. We don't recommend smoking or starting to smoke. And of course, the annual screenings and guidelines that we recommend to help prevent and recognize any future issues. I mentioned the sun protection guidelines. These are very important, and unfortunately there's not a magic window where you don't have to pay attention to this after a certain time. They do apply for the rest of your life. We recommend wearing a sunscreen of at least 30 SPF every day on any part of your body that's exposed to the sun. So even if you're here in Seattle in March, on your face and hands using a combination moisturizer sunscreen. Your skin is likely more sensitive to the sun following transplant because of medications or treatments that you've had. So regardless of your skin tone or whether you needed to wear sunscreen in the past, you'll probably find that you do require it now, and your skin is going to be more photosensitive going forward. We do recommend wearing protective clothing and hats if you're outside during the peak times from 10 to 2 to reapply your protection every hour. And so if you follow these guidelines, you don't have to stay in a bubble. You can still go on your cruise or your Hawaiian vacation, just being mindful of the sun protection guidelines. So making the transition home from your active team here can be daunting for a lot of people. We have some recommendations to help make it smoother for you. You've probably already heard from your team and your nurses that you should be setting up your appointment with your home physician for within the first week that you return home from your last visit here at the SCCA. And I have a few tips. When you call to make that appointment, call to request either a new patient or a consult appointment. This is often scheduled for much longer, 45 to 50 minute time block, as opposed to a 10 or 15 minute typical return oncology appointment. And this is necessary because your physician is going to have your whole set of transplant records, be going over this, be making a plan for your future care, and they really do appreciate having that longer time to review everything with you. The other tip is when you call your physician's office, ask to speak with the nurse or the MA. Sometimes it's called the nurse navigator, who works most closely with your physician. And this person is, they're usually really appreciative to know, just let them know, hey, I'm coming home from my transplant in the next, you don't even have to have a date, just tell them the next 2 or 3 weeks. Because they can get a lot of things set up behind the scenes that's important. Setting up your weekly blood draws for the first month, going through your post-transplant medications and sending them through for insurance approval to see what your copays are going to be. We work really closely with a lot of community oncology offices and nurses in this, especially in this 5-state region, and this is some of the important feedback they've given us for helping smooth your transition home with them. We send all your records home, whether it's by fax or CD for images. And we used to send a very large 100-page packet of our physician guidelines for care of the post-transplant patient. And these are very thorough. They cover everything from what our vaccine schedule is, what to do if you get a fever, how to work up diarrhea. And then several physicians who got a lot of our transplant patients every year said, stop sending us hundreds of pages every time you send a transplant patient home. So we listened, and those guidelines are available online, and this is important for you to know because they're accessible and available to anybody off of our long-term follow-up website. So you can access them, you can refer any of your providers or your team to these guidelines. Just knowing that they're there is very helpful. We typically recommend seeing your physician at home for the first month weekly to have labs and an assessment. Then after that, every other week for the next month, and then it's at the discretion of your doctor, typically monthly or every 3 months, depending on how you're doing. We will, you can continue using the CareZ app if you've already been using that with your active team. Once you leave the SCCA, or if you go to the 4th floor provider, the CareZ folks will change your primary care either to LTFU or your 4th floor provider, and you'll still be able to review and access any lab results or anything that was on there from your time during transplant as well. And like I've mentioned several times, is our long-term follow-up website. This is a really important resource. It's available to anybody, to you, to the community. There's a section for physicians and a section for patients with frequently asked questions, documentation, information on assessing GVHD. So being aware of what's there and being able to refer your providers to it should they need that is very helpful. All right. So thank you. That concludes the first section of our departure class video.